This is how a khat plant looks like. For those who consume it, the leaves are the most important part on the plant. You will commonly find it with long-distance truck drivers, people, especially men, who do manual work, and more recent, those under the influence of peer pressure. But what is it that attracts them to the leaves to the extent of addiction? We spoke to two health experts about this plant, Dr. Hilary Irimaso, a psychiatrist, and Dr. Hafswa Lukwata, the in charge of mental health program and control of substance use at the Ministry of Health. According to Dr. Irimaso, khat or mairungi has some components that provide a temporary good feeling.
In that they stimulate your body and more especially your mind. And that's why people take it. They take it for what they think are the positive effects, increasing on their activity, being more alert, and the high that it gives you, the good feeling that it gives you.
But what then is the danger when one is addicted to the leaves?
This also causes physical problems, because when your body is highly alert, then your saturation is going to increase. And there is evidence that these substances have actually increased on the prevalence of hypertension. There's also statistics that increased use of these substances have caused heart problems, heart attacks, and eventually death. But the most significant cause or negative effect of these substances is what we call psychosis. Psychosis is a state of mind which is basically all confusion. You tend to change, or your body changes in the way it sees or understands the situations around. You start seeing things that others are not seeing. You start hearing things or voices that others are not hearing. And when you come to our wards, probably 70 to 80% of the patients are young people, 24, 25 and below.
The two were part of a team of experts that provided evidence to Parliament on why khat should be banned and have no remorse for it.
We know that there's a lot more than just that chemical that helps people to keep awake. So those other substances that are in there are also dangerous to the brain. And continued use, of course, would lead to damage, physical damage of the cells of the brain. So once that happens, then it means someone is going to become mentally ill. They usually have substances that can damage other parts of the body. For instance, the liver. The liver is the biggest culprit, but also the kidneys. We are not going to wait for the problem to escalate. That's what happened with tobacco. That's what happened with alcohol. We are now seeing it. It has blown out of proportion that we want to act.
Whereas there is not much information about the use of khat here, the health professionals say that documented evidence from other countries that have since banned it, like UK and USA, show a burden of wasted and non-productive people. Dr. Irimaso says the possibility of reversing the effects caused by addiction to khat are almost impossible.
Very many parents are out there struggling to help their children get off these psychotropic substances. And you find that even if there's a very high chance that they will be off these substances, the cost is enormous. And that's why you find that for public hospitals like Utabika, it's like 200% full. And mainly because of these substances and many others.
According to Dr. Lukwata, Uganda is already burdened by the excessive consumption of alcohol, misuse of tobacco, and other toxic drugs, and therefore the past bill is a move in the right step to prevent a catastrophe. Walter Mwesije, NTV.